Hey, Dr. Smith.
That time again?
It is that time. We have some more questions.
Okay.
All right. Our question today comes from John, and he asks, what's the difference between an MRI and a CT scan?
Very good question. Which brings up a good point. If you've had any studies and you're going to go to the doctor to get seen about your neck or back, make sure you bring the actual studies with you. It's good for the surgeon to have the report from the radiologist, but he also wants the actual films to look at. And so frequently people will show up with just the report, which a surgeon's kind of like a carpenter that has to fix something, so we have to see what it is we're going to fix. So number one, remember to actually bring the studies themselves and also the report on what the radiologist said about those studies, because we have to have that in your file. What is the difference between an MRI and a CT scan? I get that question very frequently, but I'm going to add to it, what's the difference between an X-ray, a CT scan, and an MRI? An X-ray basically is just a single picture, so it will show the bones. If we take an X-ray of the neck, for example, we can see fractures, anything that goes on with the bones, or alignment of the bones. A CT scan is actually a very fancy X-ray that allows us to see the various bones, either in, now they can do remodeling where we can see the bones in a 3D picture, or we can see slices of the bone. So a CT scan shows the bones, but it gives us extremely high resolution of those bones. As a rule of thumb though, when we are dealing with the spine, we want an MRI scan. An MRI scan shows the soft tissue. So we're thinking maybe you have trouble with a disc or a nerve. So we want an MRI scan which will show us if, for example, you have a herniated disc, a disc that's broken, pinching on a nerve. We may get a CT sometimes, but I try not to get CTs very often because it exposes people to radiation. Just to give you an idea, we measure radiation exposure in something called sieverts. No one needs to know that, but a chest x-ray is 0.1 millisieverts, and a CT scan of the neck, for example, is 10 millisieverts. So a CT of the neck is equal to about 100 chest x-rays or 100 x-rays. Depending upon the machine, that's with some of the newer machines. Older CT scans could easily be twice that many. So one chest x-ray, a mammogram is equal to about 4 chest x-rays. A CT scan of the neck is equal to about 100 x-rays. So as a rule of thumb, we don't get CT scans very often because of the exposure to radiation, which can lead to cancer. We like to use MRI scans because in most cases we're looking for something which, like a herniated disc, and hopefully that answers your question. But the bottom take-home line message is, if you show up at the doctor and you've had a CT scan or an X-ray, he may still want an MRI scan. And whatever study you have had, make sure you bring the actual films with you to the visit so that the surgeon can see those studies. That's it. Thank you.